trying to hold my union banner. My name's Naomi Byron. I'm speaking today in a personal capacity, but I'm a rep for outsourced workers at Homerton Hospital and a Unison. Thank you.
Hey.
Nice to have support. I'm also the Joint Branch Secretary of Unison there. And I want to say a few words from one of our lost colleagues, Dr. Abdul Chowdhury. On the 18th of March 2020, he wrote on Facebook a plea to Boris Johnson from his hospital bed in intensive care, saying, please ensure PPE for each and every NHS health worker. We are also human beings to practice human rights like others, to live disease-free with our family and children. Dr. Chowdhury was one of the Homerton Hospital staff who died from COVID very shortly after he wrote that message. I'd like to talk about the outsourced staff and the support staff who generally are on lower pay and conditions than our NHS directly employed colleagues. In June, shortly before PPE was introduced across the hospitals, the Evening Standard reported that COVID appears to have spread more in hospital canteens than in intensive care units that are treating infected patients. A minister raised this in Parliament. He told Parliament that porters and backroom staff seem to be more likely to have contracted COVID than the medical staff on the front line because they had PPE. Now the article makes the point that they did not have sufficient PPE, even though it also makes the point that the government denied it at the time. We know that's not true. But they said PPE for many of the medical staff on the front line was far better than those working in other parts of the hospitals. Now, how much extra does it cost to provide hospital staff with an FFP3 mask than the normal masks that we get? Our lives are worth more than that small amount of money. This government can find endless money when it wants to, but when it comes to protecting the lives and the health of NHS workers, or, I have to say, protecting patient safety by giving proper funding to NHS services and a proper pay rise to all NHS staff, suddenly their pockets are empty. Sorry. Thank you. Now, I have to say, I think all of us are here today because they know that they won't give us what we need out of the goodness of their hearts. The only way to get what we need, whether it's PPE, whether it's an NHS pay rise, or whether it's NHS pay and conditions for outsourced staff, is to fight for it. And I appeal to everybody. We know everybody here today is supporting the campaign for proper PPE for all health staff, but to everybody watching this afterwards online as well, to support that campaign. Also, for all staff who work in health, if you're not in a union, join one today, so that you can vote to reject the miserly and insulting 3% pay offer that this government thinks NHS staff are worth. It is below inflation. It's not a pay rise, it's a pay cut. Also, campaign for whatever union you're in to hold a strike ballot as soon as possible after the consultative ballot, and to coordinate action between the different health unions so people can strike together for a decent amount of pay. But also, I would say, look at what teachers were given on the same day that NHS staff were offered so-called 3%. They were offered nothing, an even bigger pay cut. And I say, we want our unions to not only coordinate amongst health workers for action, We want them to reach out to teachers, to local government workers, to other public sector workers affected by this pay freeze and pay restraint, because this government has made so many U-turns. It's high time they were forced to make one on public sector pay. And my last point is, the Health and Social Care Bill is currently, well, when the MPs get back off their several week summer holiday, will again be being debated in Parliament. This is a huge threat to the future of our NHS because it threatens to break up the NHS and it threatens to open up the NHS to more privatisation. I urge everybody to join the protests, to push for their trade unions, to lead the way and hold protests outside Parliament whenever the bill is debated, and also to organise a mass demonstration in the autumn against the Health and Care Bill and also in defence of the NHS, hopefully in support of a strike for NHS pay. Solidarity!